Menopause is a big deal for everybody, but our patients that have cancer, we completely forget that menopause exists, and that's why it's a big deal. People are living longer after their cancer treatments, and we want to empower people to live healthy lives and to be strong and have good bones. And cancer treatment is difficult on our bodies and our bones, and menopause just kind of compacts that. As a practitioner, I think it's important to address it. If it's out of the wheelhouse of an oncologist or a physician assistant who has a really busy job already, it's just saying, you're in menopause. You should be talking with a gynecologist. Here's a resource or a pathway. So if you were going through cancer and menopause, I would be saying, we want to acknowledge this. Usually I'm asking if a woman is in menopause, or if she has had a period, and remind her that with that loss of estrogen, we really want to make sure that we are doing any kind of physical activity that we can, a little bit of resistance training when they're able, and plenty of hydration so that we can help with combating some hot flashes, but also all the dryness that occurs during menopause. We want to make sure we're having good sources of calcium in our diet and heart-healthy foods, fiber, and omega-3 fatty acids. Smoothies and soups, they're really good ways to kind of get in a few extra things, because in a smoothie, you can throw in your berries, you can throw in some flax meal, you could throw in some psyllium husk, you could throw in chia seeds. Berries are really high in fiber. Also with our soups, we can put in a myriad of vegetables, and then we can also put in canned beans. Now, someone might want to have a smaller portion of that soup because that might be very bloating. You can also put in a lot of spices like cumin, and that can really be helpful with GI distress, or ginger, and these can be really nice way to get in our fiber. Someone could use a whey protein or maybe a pea protein isolate in that smoothie. But then with soup, again, the beans would give us some protein, but you could also blend into, I really like a tomato soup with cottage cheese. And that's a good way to kind of add 12 to 15 grams of protein with every half cup. Menopause is everyone's problem. It's important for us all to be looking out for everyone's best interests and empowering people to kind of make good choices. I think also just giving people information. I understand our cancer patients do have a lot on their plate, and they are some of the most incredible, resilient people. I just think we want to keep them informed so that they can be aware that these are some of the things that they may encounter so that they can make good choices, because with knowledge comes power, and we want to empower people to live healthy lives. Ovary Active is a podcast, and it has these two physicians on it that have great people that they interview. It's very evidence-based information. I love Dr. Jen Gunter. I think she is a sharpshooter. She is very smart. She follows everything that the North American Menopause Society follows, and that is all evidence-based information. And she has the Vagenda, and she's always very active on Instagram. And the North American Menopause Society, I think they're really great. It's such valuable information, and I think they're just really working to help women live longer, healthy lives.